And thanks everybody for joining. My name is Jonathan Farrell. I work for BioTE Medical, and I'm hunkered down in my home office, just like everybody else in Florida. I live near Orlando in Winter Garden. I'm a native Floridian. I grew up in Tampa with USF. Was a biology and chemistry major. I've been in the biotech industry for about 20 years. Been with BioTE 3 years. Was 7 years with Boston Heart Diagnostics before that, about 6 years at Berkeley Heart Lab before that, and the remainder of my tenure was with Merck Pharmaceuticals before that, after I graduated from USF. So at BioT Medical, we're a hormone optimization and medical training company. We've partnered with Dr. King's practice to take a complete approach to healthier aging through patient-specific bioidentical hormone replacement therapy with some prescribed nutraceuticals. And tonight we're just going to share with you what the BioT method of hormone optimization is. We'll discuss symptoms of hormone decline, and we're going to discuss, well, what is andropause. We're going to discuss menopause and the symptoms associated with both. We'll discuss synthetic hormones versus bioidentical hormones because there's a lot of misinformation out there. And we're also going to discuss some of the supporting literature for hormone optimization, and specifically a study that was published in 2002 that many of you all may have heard about. It was called the Women's Health Initiative, also known as WHI, which after the study was published caused thousands of women to stop taking their hormones. So we want to clarify the results of that study. And so during this seminar, write down questions, notes. We'll have time with Q&A afterwards. And Dr. K and Dr. DeCosimo will be here to answer all those questions, and so will I. So let's just get started. So we're treating an androgen deficiency syndrome. And so we have to ask ourselves, okay, how do we feel? Do we feel like this, or do we feel like this? We all want to feel like this. So let's talk about some symptoms of suboptimal hormones. So extreme fatigue. Are you the person that at 2 or 3 o'clock in the afternoon have to get a cup of coffee to just get it through the day? Do you have mood swings? Do you have anxiety, tension, irritability? How about sleeplessness? A lot of people now have sleeplessness, memory loss, depression, lack of focus. What about brain fog? You ever walked in the kitchen at your house and thought, why am I here? Potentially have brain fog. Hot flashes are symptoms of suboptimal hormones. Night sweats, weight gain, joint pain, bladder symptoms, even migraine, headaches, and also decreased libido and sexual performance. So, what's the BioT method? Well, the hormones that we're going to optimize in the BioT method and balance are bioidentical. We're using bioidentical testosterone, bioidentical estradiol, estrogen, and thyroid. And we also integrate some medical grade nutraceuticals to improve results of hormone optimization. So, what is andropause? Guess what? Us guys, if there's any guys on the call, we have what's called menopause. It's called andropause. 20% of males over the age of 50 have low T or low testosterone. It's common in men with the comorbidities of diabetes, high blood pressure, sleep apnea, and it is linked to cardiovascular disease, which is the number one killer, not just for men, but for women as well. And it's often underdiagnosed. So, how can we help with andropause? Let's talk about testosterone. So, here's some facts about testosterone. Testosterone can help to protect the bones, brain, breast, heart, and relationships, and it's present in both men and women. There's more testosterone in males, less in females, but both men and women have testosterone. Men aged 30 to 70, they lose about 1 to 3% of their testosterone over time. It's a slow, gradual decrease. Women, they'll lose their testosterone between the ages of 20 and 40, about half of their testosterone each year. That's pretty dramatic. So, what are the optimal ranges for testosterone for men? So, you'll see in this graph here, men who have a total testosterone below 1,000 are at risk below 900 are at risk for Alzheimer's disease. You can also see these other comorbidities, metabolic syndrome when we're under 770. How about look in the orange, that's 600. That means if a male's testosterone, total testosterone, is below 600, they're at risk for all cause mortality. That's death. You see type 2 diabetes, all these comorbidities associated with low T in men. So, what are the positive effects of natural bioidentical testosterone for men and women? Number one, increased energy. You can improve overall well being. And you can get relief from anxiety, depression, you get cognitive clarity. Memory can improve. You can enhance libido and sexual performance. And more importantly, you can protect your bones, brain, breast, and prostate and heart. You can also increase bone mineral density with bioidentical testosterone, increase muscle strength. You can actually lean up over time and lower cholesterol. Actually, bioidentical testosterone helps modify lipids in the right way. The lipids I'm talking about are LDL, helps lower LDL, which is the bad cholesterol, and helps raise HDL, which is your good cholesterol. So let's talk about women for a bit. Menopause. Fact, 3,500 women each day enter into menopause. And so menopause happens at about age 50. But 15 years prior to menopause, females can experience symptoms. That means women in their mid 30s can experience symptoms of menopause. We can help with those symptoms by simply just giving the body the raw materials that it needs to help heal itself. Most women are affected in more ways than they realize. And you know what? Most women, they don't ever get over or get through menopause. So I said the number one killer for both men and women in the United States now is heart disease. Premenopausal women die from heart disease. The number is 1 in 7. In postmenopausal, that number jumps to 1 in 3 women die from cardiovascular disease postmenopausally. So, how can estrogen help? Well, estrogen is present in both men and women, more in women than in men, but it has over 400 functions in the body. It can control hot flashes, can maintain bone mineral density, can help with memory, and can help with your skin. You know what we call it, the happy hormone, because it increases serotonin and dopamine. So, what are the hormone therapies available to you now? And first of all, you can get either synthetic or bioidentical. And synthetic hormones come in the form of either patches, pills, and shots. And we're going to discuss those different modalities. And also, you can get bioidentical. That's what we use in the BioTE method. They're plant-based bioidentical testosterone, plant-based bioidentical estradiol. And you can get pills, patches, creams, or gels. And our preferred modality is pellets in the bioidentical form. So I said we talk about the study that was published in 2002 that was on the cover of Time magazine. It was called the Women's Health Initiative, so the WHI. This study showed that there was a 41% increase in stroke, not good, 29% increase in heart attacks, 26% increase in breast cancer, twice the rate of blood clots, and a 76% increase in Alzheimer's disease. This study was flawed, though. Problem with this study was it used the wrong drug, used synthetic, used the wrong dose. Every patient had the same dose. It was not personalized dosing like with the BioTE method. And it was the wrong route of administration. It was oral meds, not pellet therapy like we use with the implantables that go sub-Q, just in the fatty tissue in the hip area. So let's talk about patches. You know what? Estradiol patches they're pretty good. The levels you can get aren't too bad, and it's better than pills. And but there could be an adhesive problem. We're here in Florida; it's hot, and so patches can come undone. They need to be changed a couple times a week. So compliance is an issue. You can get some weight gain and fluid retention with estradiol patches, but more importantly, about 45% of people don't absorb drug transdermally, and that's how the patches work. Let's talk about how you can administer hormones via creams and gels. Now, your clinician writes a prescription for the cream or gel, but really the person doing the dosing is you, the patient. So, are you putting too much in your hand? Not enough? Are you doing it twice daily, once daily? There's a compliance issue with creams and gels. And are you actually absorbing? Are you one of those patients that don't absorb drugs transdermally? And most important, estriol cream does not protect the bones, heart, and brain like estradiol bioidentical pellets. So another modality is injectable testosterone. Problem with this is it's 99% synthetic. And this is for males. And you get kind of a roller coaster effect. If you're doing shots correctly, a male would have shots twice a week. That's 104 shots a year. That's a lot of shots. And there are side effects with injectable synthetic testosterone, like liver toxicity. It actually alters lipids negatively, meaning it will raise your bad cholesterol, it will raise your LDL and lower your HDL, your good cholesterol. And you don't want that. And you know what? Usually it wears off before your next shot, which really makes us males cranky. So let's talk about the preferred modality to get hormone, which is via the pellet. Now, these pellets are plant-derived natural bioidentical testosterone or bioidentical estradiol. It's the same chemical compound that the ovaries and testes have made since day one, and they last longer than other treatments. So the bioidentical pellets can last 3 to 4 months for females, 4 to 5 months for males, sometimes maybe 6 months. It depends on how active somebody is. And how does that work? Well, the pellets are implanted sub-Q in the hip area. It's the fatty tissue in the hip. And when they're inserted in that fatty tissue, capillaries form around those pellets. And so when the capillaries form around those pellets, when there's blood flow through those capillaries, the hormone is directly released in the bloodstream, which mimics exactly how the body naturally works. And so, if you're a CrossFitter, if you're a marathon runner, you're going to burn through your pellets a little faster than somebody that has a sedentary lifestyle. That's why it's every 3 or 4 months when a female would be pelleted, and every 4 to 5 months for a male. It's actually the hormone replacement modality of pellets is the most widely studied form, and you get a steady state of hormone in your blood rather than peaks and valleys like you can get with oral and injectable meds. With the pellet therapy, this is personalized medicine. There's an individual dose for each patient. And pellets, they're not new. A lot of people don't know about it, but hey, they started in this country in 1939 for women who had radical hysterectomies. And in 49, estradiol and testosterone pellets were used for symptoms of menopause. And there's over 75 years of utilization with pellets. It's the most widely studied modality for hormone replacement therapy. So let's look at blood levels for estradiol. Let's compare all these modalities. We'll compare the estradiol pellet implant, which is the green line in the middle of the screen. You can see a steady state of hormones. The oral is the purple line. So you see these peaks and valleys. You're not getting a steady state of hormone with oral. And with patches, you can see a patient can have a optimal level for 2 or 3 days, and then they have to change their patch. So it's not as the peaks and valleys aren't as much as oral, but not as beneficial as a steady state as an implant. So, what is the BioTE method of pellet therapy? Well, we're just helping the body return to its normal hormonal balance and physiological state because we're going to use the right kind of hormone, bioidentical, not synthetic. Use the right amount. We're going to have individualized dosing for you, and we'll use pellets. So, pellet therapy, safe, evidence-based, really over 80 years of literature and 75 years of experience. There's no roller coaster effect when you're using pellets, and you only have to get pelleted 2 or 3 times a year. Very low side effect profile as well. And it is the best method to increase bone density. So women will say the age of 50 is menopause. 5 years post menopause, a woman will lose a third of their bone mass. In order to help ameliorate that, it's best to get your hormones optimized. We can help prevent osteoporosis and osteopenia with just optimizing hormones. There's no evidence of increased breast cancer risk, does not stimulate breast tissue, no increase in blood clots or heart attack or stroke. There's studies that show hormone optimization can be protective to the bones, brain, breast, heart, and relationships. Let's talk about breast health. Hundreds of studies. The take home is testosterone delivered by pellets does not increase the risk of breast cancer. Testosterone implants have shown less stimulation of breast tissue. When you have treatment with testosterone pellets and estradiol, it doesn't increase risk of breast cancer. Estrogen alone does not increase the risk of breast cancer. Here's a breast cancer study, and this was HRT, hormone replacement therapy, after a diagnosis of breast cancer, and it's in relation to recurrence and mortality. So it's a study where there's 2,755 women aged 35 to 74. Now, the breast cancer reoccurrence was 17 per 1,000 patient years in the women who received hormone replacement therapy. It was almost double in the patient population that did not get hormone replacement therapy. When it comes to breast cancer mortality rates, 5 per 1,000 person years, and it was triple that in the patients that did not get hormone replacement therapy. So total mortality rates in the study, 16 per 1,000 person years, but almost double in those that did not get HRT. That was in the Journal National Cancer Institute, published in 2001. So bone health. Talked about how females lose a third of their bone mass 5 years postmenopausal. So, what can we do to increase bone mineral density? Well, testosterone is a great bone builder. There's a fourfold increase in bone density over oral estrogen, and 2.5 times greater than patches. With pellets, you can get up to an 8.3% increase in BMD. That's bone mineral density, almost twice that what you get for patches, and almost 4 times with oral estrogen alone. So arthritis is now the fourth leading cause of disability in the United States. 10% of men and 80% of women over 60 have OA. Both estrogen, bioidentical estrogen, and bioidentical testosterone can stimulate precartilage cells and possibly reverse the development of arthritic tissue. So I said how bioidentical hormones can help with brain health. Well, women get Alzheimer's disease 8 to 1 over men. Women that are on estrogen, 50% less likely to develop Alzheimer's disease. And men with low testosterone, they're 3 times more likely to develop Alzheimer's disease. It's a very good reason to actually optimize your hormones. So I said heart health. I said heart disease is the #1 killer for both men and women in the United States. Well, estrogen replacement with pellets has a positive effect on just body comp by reducing body fat, but also can help improve lipid parameters, i.e., can help lower the bad cholesterol, LDL, and increase the good cholesterol, HDL, and also helps lower triglycerides. In addition to testosterone, there's no negative favorable effects of estrogen on LDL cholesterol, but you can get some fat mass reduction with the two combined. There's so many studies that show beneficial effects of natural testosterone on the heart. It's a vasodilator. It's great for the heart. So let's talk about men in the heart. Well, testosterone in men actually decreases the bad cholesterol, LDL, and raises the good cholesterol, HDL, and lowers triglycerides. You can lean up with bioidentical testosterone. There's many studies that show beneficial effects of natural testosterone on the heart in men. So, what are the side effects? We talked about all these great things. What are the risks of getting bioidentical hormone replacement therapy via pellets? First insertion that you can have some fluid retention. You can have a little bit of swelling in hands and feet. In us in Florida, yes, it's hot, humid. That could happen, but it's less than 2% of patients experience side effects. Most common side effects are breast tenderness, uterine spotting or breakthrough bleeding, mood swings, irritability, pellet extrusion through the incision site, and just those are usually patients that aren't listening to the post-insertion instructions that we will provide for you after the procedure to prevent that. Facial breakout is less than 2%. And in male, there can be some testicular size reduction and sperm count reduction. So here's some just facts. Key facts: hormone imbalance can occur in men and women at any age, and not all therapies are created equal. Hormone balance is not a one size fits all approach, and you need a certified professional that knows what they're doing. And you have that here with Dr. DeCosimo and Dr. K. Now, we need blood work, lab work. to even identify, hey, who's a candidate for hormone optimization. But labs can be a little bit deceiving. Labs may say you're in the normal range, but you may have symptoms. So if you have symptoms or treating an androgen deficiency syndrome, we'll still treat you even though labs may say normal. We want you to be optimal. So the first step would be to get some blood work. That's all I have. Now we have time for Q&A with Dr. K and Dr. DeCosimo.
Dr. Lillian DeCosimo, board certified OBGYN, a women's health and well-being specialist. I've practiced OBGYN for over 25 years, and I have a passion for women's health, especially female sexual health and well-being. And we need to maintain that throughout all stages of women's lives. I think that, and I truly believe that my patients will experience optimal wellness using a more natural approach, as Jonathan just talked to us about the BioTE method. I believe that with the bioidentical hormone replacements that we can certainly maintain sexual vitality throughout our lives. So we're open to any questions that you may, have. Certainly, when women go through various stages of their life, their hormones start to decline, and this can occur certainly as early as in the 20s, and by age 40, up to probably 50% of patients will have a serious decline in their hormones, including testosterone.
So, Dr. DeCosimo, can you hear me? This is Kay.
Yeah.
Can you hear me?
Yes, I can hear you. Can you hear me?
Yeah. So, can you explain to the audience, how the perimenopausal, postmenopausal women should think about bioidentical hormone replacement therapy and the sexual health and wellness that you are so passionate about? How does one get started?
Well, we want to go ahead and maintain our sexual vitality throughout our life. And in the stages of premenopause, we know that our ovaries and adrenal glands are still producing our hormones. But again, we get a testosterone deficiency. And starting as early again as age 20, women will lose up to 50% of their testosterone levels. And this a lot of times will manifest with decreased libido, decrease in sexual thoughts or fantasies. Women will start having vaginal dryness, and certainly that all leads to not wanting to engage in sexual activity and having problems with their relationships in general. And in perimenopause, which is a time where the estrogen levels do begin to decline, and that causes irregular periods or absent periods. Women will have hot flashes, mood changes, vaginal dryness, breast tenderness, poor sleep, headaches. And I see, even though I can't see you, you have probably a lot of our listeners that are women are nodding and saying, yeah, that's me. Headaches, worsening migraines. And so are basically the testosterone level declines significantly and causes a shift from low libido to no libido, a decrease in sexual satisfaction, in addition to other, issues associated with perimenopause that all contribute to a general low sex drive. After menopause, then you're totally depleted, and at that point, you go to your physician. And a lot of times, a lot of doctors don't know how to reverse the negative impact that this lifelong decline of hormones has caused. And here, we're able to offer with the BioTE method a variety of solutions to help restore, your healthy sexual vitality. Obviously, with careful testing, we can, help determine what's the best course of treatment for you. As Jonathan said, it's all about individualized therapy. It's not one size fits all.
I think, thank you, Dr. DeCosimo. There's an audience member who raised a hand. I think, Matt, could we have her ask her question?
Sure. Yes.
My question is this.
Yeah.
Do you have to go off hormone replacement therapy tablets for a while in order to have blood work done so that you know what your levels are normally without the hormone replacement therapy?
No, we don't necessarily recommend that you don't need to stop your current medication in order to test your levels.
So the levels won't be artificially inflated because you're on it?
No, not at all.
Okay, thank you.
You're welcome. Now,
So
I want to mention what are the benefits of the treatment, and questions that you should definitely ask us is what can you expect from a natural hormone balancing regimen? And our answer is pretty simple. We want relief from these unwanted symptoms. You should expect improved libido, more vaginal lubrication, fewer night sweats and hot flashes, improvement in your moods, memory, sleep, renewed strength and energy, and the ability. Actually, this resonates a lot with women, is that the ability to shed pounds easier, and a belly that goes from fat to flat. So we all want that.
So Dr. DeCosimo, is it fair to say that this is not just psychological improvement of well-being, but an actual functional and physical well-being? So do you have to add any adjunctive procedures to improve functional aspects beyond hormones?
We can, and we have other treatment modalities. Obviously, we're treating the root cause, which a lot of times is the hormonal imbalance, and you start out with that. And then we have other medications that have been recently approved for treatment of low desire in females. Obviously, too, we're trying to improve the pelvic floor and the tissues there in the pelvic floor. It's been shown that if the tissues are lax, that can also affect sensitivity and ability to reach orgasm. So it's important for women to have all these things looked at, and it's not a one stop. It's not a one therapy thing. As sometimes it's a combination of therapies. And I think here at Suria we have the advantage that we can address all those problems, whether they be one factor or multifactorial, which a lot of times it is.
Yeah, one of the things that I want to stress to the audience is that this relationship and this partnership really between Dr. DeCosimo and myself as a plastic surgeon is very beneficial because we look at everything holistically, look good, feel great type of a motto. And so I think this combination of managing women as a holistic, kind of a concept, it makes a lot of sense to us at Suria Plastic Surgery, and that's the relationship that we're trying to foster and kind of communicate to everybody in the audience at large. So I have another follow-up question, Dr. DeCosimo. So do you think in that general vein of discussions, cosmetic gynecology has any role in optimal sexual health and wellness?
Definitely. I think it's all interconnected. As you said, Dr. Kusuma, it's about feeling good and looking good. So a lot of times women will have their hormones optimized. They'll be able to lose that weight that was kind of stubborn. And now they're looking at, okay, well, how do I improve that laxity in the skin? And, that's where they'll probably come and consult with you. And then in terms of cosmetic gynecology, we also, offer improvement of the external genital area if there are any concerns with aging and childbirth and previous surgeries. There can be some issues with the girth or the width of the vagina or the appearance of the labia. And again, it's all subjective. It's probably just a matter of again making the patient feel like you're living the best years of your life, and that should continue till we're 100 or more, I think.
Does this hormone replacement therapy have any impact on any mild incontinence or leakage that women have, or is it a completely different discipline?
No, I think certainly, again, it's multifactorial. So when patients come in experiencing some genital or urogenital symptoms, whether it be dryness or mild incontinence or a little looseness in the vaginal tissue, certainly optimizing the hormones is going to be essential. And then we can add our other treatment modalities, whether it be treatment with radiofrequency or any plasma-rich therapy injections, Kegel exercises, or in some cases, we'll need to do some surgery to help reconnect the tissues. So we can offer it. We have it all, and we're able to not necessarily. We're able to offer it to our patients, and we're not going to just say, "Oh, we don't know what else to do with you." We have all the instruments and the staff and professionals to help our patients.
Well, I mean, so how often are people pelleted? In general, is it every few months or every year? How often is it done?
Well, as Jonathan mentioned, in women, normally it's anywhere between every 3 to 4 months, and it usually has to do with the level of activity. So, if you have someone who is an exerciser and is using their gluteal muscles a lot, then those will probably burn through the pellets a little sooner. So, you'll probably be counseling these patients to come in. On the 3 month side versus someone who's more sedentary, then they're going to probably benefit from having their pellets inserted every 4 months. Same goes for men as well. We offer pellets for males, and usually the interval for men, it depends on their activity as well, is between 4 to 5 months.
This is a question that I'm sure the audience may want to know about. How long does it take to actually do the procedure itself?
It's a very simple procedure. I would say from start to finish, less than 5 minutes. And pretty relatively painless. The only thing that you'll feel is a little injection of a numbing agent that we put on the skin, that we inject in the skin prior to inserting the pellets. And then again, it's a matter of it being done in less than a minute after that.
Yeah, just again for the audience purposes, I'm trying to play the role of an audience member to kind of ask the questions that other people may have on their mind. But
Yes.
I just want everybody to know that we have two facilities that we do this out of. One is Implantation, which is our main office, and there our nurse practitioner Kim Bisogno, who's also trained in this, offers it in addition to Dr. DeCosimo. And we also have our Boca facility where Dr. DeCosimo sees patients and pellets patients there as well. But I also want the audience to know that we do also do virtual consultations, anytime, even during this downtime where we cannot be in the office. So if anybody's interested, please go to our website, suriaplasticsurgery.com, and there's a button there that says, book your appointment. You can certainly book your appointment yourself from home, from your computer or your phone. And then from there, our office staff can contact you and set you up with the technology needed to do a virtual consultation when you're down in the downtime. So looks like there's a couple more questions here. So let's see what they have to ask.
Hi, how long, what exactly is the post-care for the procedure?
That's a great question. So right after the procedure, we'll place a Band-Aid and a piece of gauze on top of the area where the pellets were inserted. And then we'll instruct you to not remove the bandage for a day, and to avoid any hot tubs, pools, and any activity or physical activity that involves using the gluteal muscles, like squats and bicycle riding and spinning, cycling. And you have to do that for about 3 days. Next
Great.
question. Yeah.
Are there any contraindications, Dr. DeCosimo, to this treatment that people should know about right off the bat? I mean, like people who are thinking about any like top 2 or 3 contraindications that can come to mind?
Actually, we pretty much can pellet most patients. There is a contraindication to patients that have a history of a seizure disorder, and also patients who have been diagnosed with Alzheimer's. Those are two patient populations where we want to try to avoid pellets. But other than that, Jonathan, you can chime in if I'm missing something, but I think that pretty much we can pellet anybody.
So one of the advantages, it appears to me, is that for our patient base, many of whom are women, most of whom are women in our practice, seems like if it's a every 3 to 4 month cycle, you can combine a few treatments. For example, you could get your Botox and your pellets at the same time or around the same time, so that you're on a regular schedule, and
Correct.
possibly skincare treatments at the same time as well, because many times we do have many patients who come in on a regular basis to do a lot of different things. And one of the advantages of having a kind of a very comprehensive center is to offer a lot of these, services, as a one-stop shop, where a lot of the expertise and a lot of the know-how exists in one place. Seems like a good idea. Is there any contraindication you can think of for people to undergo Botox or any other smaller surgery along with the
No,
injections?
actually, that is an excellent idea. And patients that are already patients getting these cosmetic services will notice if they start the BioTE method that their skin, hair, and nails will be stronger, and it improves collagen production. So it has a synergistic approach to helping with cosmetic results. So I definitely think that it's a great idea.
So, Dr. DeCosimo, I mean, I would imagine, many women probably, don't think about this much, or even for men, even less probably. Do you think that the conversation starts really at the primary care office, or, do you think, in your practice as a gynecologist, do women talk to you about it with you directly, or how does one get started? Again, that seems like should women talk to them, to their primary cares about it, or should they talk to the gynecologist?
Well, I think the conversation starts probably with the primary care, who 9 out of 10 times will probably raise their arms and kind of not know exactly what to do. And then the next step is, if you're a woman, you're definitely going to be sent to your gynecologist, and there you only get good help if your doctor has been trained and informed on bioidentical hormone replacement, and that is something that is there. The BioT method certainly is trying to spread the news, because this is a life-changing treatment for patients. I have been in practice for 25 years, and honestly, there was nothing. Even though this has been around for a long time, it wasn't mainstream, and it wasn't something that we learned about in medical school. So the fact that we can now offer this therapy to our patients, to me, has been really satisfying. And because I see the results, and I certainly hear patients that come in, and they're satisfied at the end of their visit, when they have completed the treatment, which sometimes before it's kind of hit or miss, especially if you're using commercial non-bioidentical hormone replacement therapy that is formulated pretty much one size fits all. It doesn't work. It does not work. So this method of delivery of hormones is optimal and is preferred and is safe. So how can we not tell our patients about this?
Looks like we have another question.
Is there anything that has to be done on my part after the pelleting, like any kind of medication or supplements that would be recommended?
Well, there are a few nutraceutical supplements that we recommend, and I don't know if Jonathan wanted to talk a little bit about those.
Sure. Yeah, there's four that we use that are synergistic with the pellets, vitamin A, D, K, and that's to help to get that 8.3% increase in bone mineral density. Also, methylated forms of folate, because about 60% of the U.S. they don't methylate, and methylation is very important in estrogen metabolism. And this is just methylated folate, B2, B6, B12. We also use some probiotics. Gut health is very important, and we use the product dim. It's from cruciferous vegetables like bok choy, broccoli, and it's important in estrogen metabolism, and it's a mild aromatase inhibitor. It helps prevent this conversion of testosterone to estradiol. So those four we we use with the treatment, and I think you have a special for those that are interested in treatment, after this program. And I think you also have another special for waiving a hormone consult. I don't know if Jen, you want to talk about that, or Dr. DeCosimo.
Jen,
Yeah.
you can go ahead.
So
Mhm.
go ahead, Dr. DeCosmo. You can answer.
No, he was talking about the specials, and I'm not. I was going to defer to Jen to talk about the specials.
Yeah, I think we will post some of this later. Let's just kind of keep it very content oriented at this point as far as
Sure.
special is concerned. We can certainly go over that, but we do want to let the audience know, and we want the audience members to let their colleagues know, or their friends and family members know, that we are going to be doing follow up events like this, either on Facebook or either on Instagram Live, or even on Zoom, as we're trying to do now. We are going to do more of these. And one of the topics that is of interest, I think, is going to be about nutraceuticals, similar to cosmeceuticals for skin. And nutraceuticals are going to be a hot topic that we're going to talk about in the very near future, as it relates to overall health and well-being. And we're going to invite a very significantly involved researcher that BioTE is going to provide, to graciously host that as well. So we're going to do that in the near future, and we'll update. And please look at our outlets, our social media outlets, on our website, and email campaigns that we're going to send out if you guys are interested in joining.
I think another thing to mention is that during this time where we're I guess stuck not doing anything, this is a great time to review this information, and write down your questions. And certainly once our quarantine is lifted, then we can start sending patients to our office or to the lab to get the lab work done, so that they can come in for the pellets. I think we didn't really harp on this very much, in terms of one of the benefits of the bioidentical hormone replacement. But during this time of concern, we do have to mention that it does improve our immune function as well. So that is part of optimizing well-being and health in general.
So there's a question that came up that I just saw as well. Could you, or Jonathan, either of you can comment on this? How does hormone replacement, the bioidentical hormone replacement therapy, interact with thyroid hormones? And then is there something that you guys can kind of elaborate on thyroid hormone specifically?
Yeah, so in the blood work, there's going to be a thyroid panel. So Dr. Cosmo may optimize thyroid as well, because some of these symptoms that we talked about could be a thyroid issue. And we'll use desiccated thyroid. It is a natural thyroid, and that too will help. If we can optimize, it's called your free T3. If we can optimize it, it's synergistic with testosterone estradiol optimization for females.
Great. Does this hormone replacement therapy interact with any diabetes patients at all, or is that also beneficial to diabetes patients as well?
Definitely
Beneficial. Yes, it's beneficial. Patients with diabetes will get improved glucose control, and their hemoglobin A1C will also reflect that as well.
Great. We're coming on about an hour's time already. So Matt, if you can put up the list of topics that I want the audience members to know. So we are in a moratorium of actually doing procedures and seeing patients at any office in the country now for at least the month of April. However, we are able to do virtual consultations. Again, you can schedule your own appointments online. You can, certainly call, but I would recommend doing it online directly yourself. It's easy to do, and once you do that, we're able to connect with you very quickly and do all of the virtual setup right from your home. So some of the topics that we're going to cover in the upcoming, few weeks are going to be listed on that screen if you guys are able to see it. Some of you joining on the phone who can't see it, these are going to be just a variety of topics. One of them is how to choose a proper breast implant, what are the options available for lip augmentation, what are the various types of facelifts, what are the various types of non-surgical skin tightening procedures that are available, what are the various types of fillers, and what are the differences amongst the fillers. What is the difference between nurse practitioners, dermatologists, plastic surgeons who do such services, and who should you choose and why? What is specifically something called an art facial, and why is it as good as it is? What is fat grafting and how does it work? What is regenerative therapy in general, and how is it applied in aesthetics and wellness? Skin cancer, and how do you get great outcomes from skin cancer treatments? What is breast implant illness? How does one prepare for surgery, for any type of surgery for that matter? What are the various types of breast lifts that are offered? So there's a plethora of information and interest out in the market of people who want to know very good, solid information. These are some of the topics that we're going to be covering in the upcoming weeks. And please look out for these posts on our social media outlets, our website, like I said already. And if there's anything that you guys are interested in hearing about, please do comment on our social media outlets to give us some ideas. We'll certainly cover those as well. So in conclusion, I thank you all for joining. Thank you, Dr. DeCosimo, for participating and answering all these questions. Thank you, Jonathan, for coming on to give us that great presentation. We may even do one or two more of these virtually, because I think this is going to become the norm of the future, very much. And all of us have to get good at this and become very facile at this. So thank you for joining, and thank you, Matt, for helping us coordinate this event today. Are there any last minute questions from anybody before we end the event?
I want to make a final, comment. Please remember that we're here for you, and bioidentical hormone replacement therapy is to maintain sexual vitality and improve general health, stamina, and sexual desire and performance. And if you've noticed any unwanted shifts in your sexual vitality, it can very well be a result of unbalanced hormones, and you don't have to suffer in silence. We here at Suria are experts in bioidentical hormone replacement therapy, and we can help you identify a solution that's going to work best for your individual needs. So your sex life does not have to slow down as you age. Please schedule a free virtual consultation and get on the path to renewed sexual vitality, well-being, and overall better health.
Thank you. Thank you very much. Thank you all. Have a great evening. Bye-bye.
Thanks, Dr. K. Appreciate the opportunity.
Thank you.